Hello, everyone, and welcome to this webinar with myself and Dr. Katrin Brauer, and it's titled Your Guide to the Portfolio Pathway, which was formerly called CSER. And that is, if you like, if you want to be in the UK, it's sort of the foundation for someone from abroad who's not trained in the UK to build a successful radiology career in the UK. That's what this talk is about. I'll just introduce myself, and then Dr. Katrin will introduce herself. So my name is Koshy Jacob. I'm a consultant radiologist. I trained in the UK and so I have a CCT. But I know a lot of people who did the CSER route, including a colleague of mine, and I know it's how difficult the process is. And we've been thinking for a long time. One of the things we've been asked for a long time is if we can run some kind of support program for those who are applying for CSER. And it's been many years later that we've decided that we're going to have a stab at it, really helping. But for that, I've got Dr. Katrin Brauer, who was the ex-chair of, she's a consultant radiologist as well, and she does practice radiology, but she also has a very successful career as doing integrated medicine. She'll introduce herself. Katrin and I have known each other since the pandemic, when we started doing some coaching together, something called the Coaching Circle. And Katrin has been personally of big benefit to me, both from my kind of personal health, but also sharing ideas. More importantly, though, for this webinar, she was the ex-chair of the Equivalence Committee of the Royal College of Radiology. So she's very well experienced on what is required. And even though the whole portfolio thing has changed a little bit, it's actually very similar to what it used to be. It's just been rebranded. Perhaps they've, as she said to me last night, they've increase the amount of things that they will accept as evidence. So I'm going to let Dr. Katrin introduce herself.
Thank you very much, Koshy. Really kind of you, and welcome to everyone on this call. So yes, Koshy had said, I too am a consultant radiologist, although not working in the NHS full-time anymore. I do the occasional locum, but I'm still very, very passionate about education, mentorship, coaching, and of course, health, well-being, and nutrition. So I've branched out a little bit. However, for the purposes of this talk, my expertise comes from having been a member of the Royal College of Radiologists Equivalence Committee for about 4 years, and for the last 2 years, I was one of the 2 chairs of the meeting because we rotated given the amount of applications coming through and obviously a lot of professional commitments. It was quite sensible to actually share the duties and the workload with someone else, because back in these days we still had to commute down to London at least once a month. So during this time, during these 4 years and including these 2 years as a chair, I've seen a fair amount of applications coming through, anything from quite poor quality standard to excellent applications, which made it very easy for us as a committee to approve and make recommendations to the GMC. So I think if we'll just, Koshy, if you just go forward to the next slide now. So we just want to talk a little bit about the portfolio pathway, because as Koshy already said, this is your route for becoming a consultant in the UK. And this is an option for radiologists who have not completed a UK training program, which leads to CCT. So we're going to go through a couple of these options. So the benefits of this newly rebranded portfolio pathway is obviously you're increasing your chances professionally for getting a substantive consultant post, but this also includes teleradiology opportunities and academia, research, and so on. So for anyone who's really serious about living and working in the UK in the longer term, this is an excellent opportunity, and I would highly, highly recommend it. So we'll go to the next slide. The new curriculum, or the curriculum for the Royal College Radiologists is a few years old. However, almost exactly a year ago to the day, I think it was on the 30th of November last year, the legislation had changed slightly, and what used to be CSER has now been renamed as the portfolio pathway. However, interestingly, when you go on the Royal College of Radiologists website, it is still named as the equivalence committee. Some colleges have changed their the committee names. The Royal College of Radiologists hasn't done this, so, and I think that's a good reason, because there's still a large component is still really trying to prove equivalence of training and experience. So what has now changed is that anyone who applies to go through this pathway needs to provide evidence that, and the focus here is on knowledge, skills, and experience for you to practice as a specialist, as a consultant radiologist in the UK. The benefits of this new pathway is really that you have a lot more flexibility, and a lot more evidence can be accepted to get the certificate. So what we need to know is that from let's say before the pandemic and now, the amount of consultants who are coming through this CSER or our portfolio pathway has really increased, and it's now, I think, sort of over the last year, it's now about at least a third of the workforce of new consultants comes through this particular route. So it's not an outlier, it's not unusual anymore, whereas maybe a few years before it was a lot rarer. So we see a lot more. And when we go when we come to the next slide, yes, we've got this. The points to remember here is that you, as an applicant, you have to be absolutely familiar with all the Royal College guidance before you submit. You have to collect your evidence, and as before, this has not really changed. The focus is really predominantly from the last 5 years of clinical practice. And you need a minimum of 4 referees. I think we got this in a later slide as well. So there's a lot of things to consider and to go through. So who is eligible to apply? Basically anyone who has got a specialist medical qualification in radiology, or if they have completed at least 6 months specialist radiology training in a specialty they plan to apply in. And there's also still an opportunity. Some people have, for instance, trained in the UK, but for some reason haven't been able to complete their training scheme. So they can also still go through this route to achieve equivalence. So what is important is, as I said, you need to know exactly what you're dealing with, which means you have to read and follow the specialty-specific guidance which has been published from the Royal College of Radiology and GMC. And obviously this for our specialty, this is for clinical radiology. Also, it's been stated that whenever someone is working on this application, it's really important to always cross-check with the GMC website, because the guidance may change, it may be updated. So last update, for instance, from the specialty guidance was in March of this year, and the last curriculum update has been in May last year. So if you just, for instance, print it off and then have a hard copy at home and you're working through this, you might miss in case there are any updates. So this is really important. You know, by all means, have a printout at home when you're working on it, but always make sure that this has the absolute priority. So when you are coming through this pathway, you need to show, as I said, the focus is on knowledge, skills, and experience. So you need to have evidence which covers all your training, any qualifications you have gained, where you've been employed, and sometimes some people have worked in different countries, not just different hospitals, but also in different countries. You need to be particularly organized for each of these, what is called CIP or capabilities in practice, which you can cross-reference with the RCR curriculum. And the focus here is, as always, quality is always more important than quantity. So don't think if you swamp the application with loads and loads of low quality evidence that you will get easily through. I'm afraid it is not like this. As we said, the FRCR as one of these major steps on your path to become a radiologist, it is not absolutely important. Well, when I say absolutely important, it is really, really important. But if someone has, for some reason, has not managed to either get it or not had the opportunity, there's still a way around it, but it makes it a lot more difficult. So I would say, if anyone is thinking about going through this route, please make sure that you settle here and you pass your FRCR, because your life will be so much easier in so many ways. Yes, you don't need multiple copies of evidence, so there's a way in the application form you can cross-reference your evidence. You need to have your primary medical qualification in your country verified, but you also need to have all the evidence about any specialist medical qualifications. And as we already said, everything needs to be aligned to the curriculum or the syllabus, and most of the evidence should be from the last 5 years, if at all possible. You obviously also need things like a CV, you need employment confirmation letters, you need rotas, you need workload statistics, you need a patient feedback if possible, and reflective practice has become something that's increasingly important and highlighted from the GMC and the colleges. In the past, maybe let's say 10, 15 years ago, it was very much about submitting just simply certificates of attendance. However, nowadays, the shift has been much more towards reflecting on what you have learned and how has your practice changed. So this will be really evaluated during this process as well. When it comes to completing and collecting evidence, there are 12 so-called CIPs or capability in practice folders, or you can say individual areas, and they have to be followed. So each of these CIPs has recommendations in the specialty guidance. It will tell you exactly how you can evidence your experience, and this is something obviously you will need to go through. So just to really quickly mention these individual folders or these individual categories. The first one is professional values and behaviors, which is pretty much the good medical practice, ethical conduct, accountability. It's standards set by the General Medical Council for professionalism. It's about communication, patient care, how you handle your own responsibilities, how you are in particular challenging in situations. So there's a lot of things that are applicable for this particular area. The second one is very much geared towards the UK health system, and I know that not everyone who applies has already worked in the UK. From my experience, I would always recommend, if someone is really considering to come and move to the UK and go through this now portfolio pathway, to consider taking up a locum post here in the UK, because it makes a lot of evidence collection so much easier, including the annual appraisal, the multi-source feedback. Some countries don't have these very formalized processes, and then it can be a lot more challenging to try and collect and upload as evidence. But if you're working in the UK and you're in this system, you will get your annual appraisal. You will have to provide multi-source feedback as part of your revalidation on at least once during a 5-year cycle. So it really makes a lot of sense to come and really be familiar with the UK health system. The third area is clinical governance and quality improvement, and this covers many audits and quality improvement projects. For audits, also very important to close audit cycles so that you can really prove that you understand what an audit is, but also how do you handle complaints and incidents, duty of conduct, and so on. The fourth area is evidence practices and data safeguarding. So this could be anything from literature reviews to participating in meeting. Have you been trained in data protection, for instance? So there are a lot of things that you can actually evidence in this area. The fifth area is very easy, I think, for most radiologists to satisfy, which is teaching and supervision, because most radiologists, I would say probably pretty much everyone, is at some point in stage in their career involved in teaching, either being taught themselves or teaching others. It could be teaching other radiologists, teaching maybe radiographers, teaching medical students. So there's a lot of opportunities, or maybe even teaching online. So these things are very important and quite easy, I think, from my perspective, really to collect. The next area is teamwork and leadership. And this is, even in radiology, even though we're working pretty much on our own when we're sitting in front of computers and reporting, a lot of our work centers around team activities, such as multidisciplinary team meetings. A lot of radiologists, especially once they are a little bit more experienced, also take on various leadership and management roles. And again, if there is any evidence or experience there, this is something you need to upload. If you do not have any evidence in this category, especially in terms of management leadership, you can, for instance, get around it by enrolling in management leadership training, for instance, and can prove that way that you have got some insight into this area. Then the seventh area is about imaging, selection, and tailoring. So this is about protocoling, which as a radiologist you will have to do on a day-to-day basis. But it's also about clinical communications with colleagues, maybe changing particular examinations, doing audits, and so on. The eighth area is about reporting, and here you will have to submit a variety of various imaging reports mainly for the last 3 years, but really covering all areas of your work and also making sure that everything is covered which correlates to the curriculum. And then as the ninth area, we have the imaging procedures and lists. And again, this is about reports, about correspondence, courses, CPDs. So this should not be a big problem. And then the 10th area is about image quality evaluation and optimization. And again, radiology reports come into this area as clinical correspondence, for instance, reflective activity as usual. It's time labeling, maybe rotas, work schedules, it's incidents, how you're reporting, because the system might be very different from the UK, for instance. And then the 11th area is all about emergency care, and most radiologists are involved in on-calls. There are a few, of course, who are not providing on-call. However, there might be emergency coverage required, rotation in the department during the day to cover, let's say, A&E or to cover ITU or whatever. And there's evidence that needs to be uploaded in this respect. And lastly, the 12th area is MDT meetings, which we have already touched on. So here you need to collect evidence about participation and involvement in MDT meetings. So there's a lot of things to consider, even though we'll kind of run through this. Overall, there's a lot of documents, a lot of evidence to be compiled. And what is really important, well, some of the mistakes are which might end up someone being rejected for this application, for instance, when there's not enough evidence submitted, or if it does not satisfy the dates, for instance. So when it comes to organizing your portfolio, think about it before you get started, exactly what you need to collect, how you structure it, how you can cross-reference between the specialty guidance and the portfolio requirements so that you have sufficient material for each individual aspect of this portfolio. And as part of this collecting evidence and documents, it's very, very important that you anonymize and authenticate your evidence. Not anonymizing evidence is actually handled or seen as quite a serious breach, because you are, according to good medical practice standards, you are required to meet this at all times. And if, for instance, someone is a bit sloppy in their preparation and then submits evidence which still contains patient identifiable data, and if it's then highlighted and flagged up to that person and with a request to change this, if they then don't take this on board and learn from this, they might even be referred for fitness to practice investigation for breaching GDPR. So you can see how serious GMC actually takes these breaches. So any qualification that's been obtained outside the UK, you will need to have certified as a true copy. And then later on, you also have to physically post the authenticated copy or evidence to the GMC as a hard copy once the application has been submitted. And this can be, for instance, done by a solicitor, by a notary, or the awarding body, and it always needs to include the official stamp, including signature and the date, to confirm that this document is indeed a genuine copy of the original document. So it's very, very important. Also, any evidence which is not in English, it has to be translated. And unfortunately, Google Translate is not the way to do this. So you will have to, if you don't have an official translator yet, you will need to find someone who can do this work for you. So when it comes to preparing for success for this portfolio pathway, remember, it takes time. When radiologists have asked me how much time should I allocate, I always say, at least a year. But it could be 2 or even 3 years for some people until they have all the evidence together. But once you actually start the application process, you then have 24 months to submit it to the GMC. And once it's with a GMC, the processing time, turnaround time is between 3 and 6 months. But you have to really, before you hit this initial button, you really have to think about what you need to collect.